And we here at Auricle, we offer you these four features. We have live classes, recorded sessions, notes, and MCQs. In the live classes, the educator comes online and they teach online. And if you have any doubts, you can get clarified then and there. And the recorded sessions, you have videos which are very crisp and clear and concise. Basically, everything that you need to pass your theory as well as your prof entrance examinations. And we have notes which are based on the recent CBME curriculum, and which it has a lot of flow charts, a lot of images, and a lot of questions also, which are very useful. And the MCQs are very they are again based on the recent CBME curriculum, which are useful for your upcoming next examination. We have a personalized counseling guidance also, where we have a mentor who will be dedicated to you. They'll analyze your strengths, weakness, and how much you should study, what you should study, and everything, and they'll give you a study plan. They'll be like your friend basically. And we have three different subscription models: basic, standard, and premium. In the basic model, you have pre-recorded sessions, live class, and quick revision examination modules. In the standard, along with that, you also have live doubt clarifications. You can anytime just pick up your phone and ask the doubt. And the premium is all in one kind of a plan, where you have everything, including personalized guidance. And you can use my coupon code Dr. Sushma for any additional discounts on the subscription. Okay. This is a tentative schedule that we have, and the end of today's class, we'll be done with pharyngeal arches, right? We are halfway through embryology already. Yes. Now, guys, we are starting with pharyngeal arches. So I hope you have, if I have to just recap whatever we had done, we had learned how epiblast finally gave rise to three different layers, that is ectoderm, endoderm, and mesoderm. And we also learned in the ectoderm, we have two, neuroectoderm and non-neuroectoderm. In the neuroectoderm, we learned how neural crest cells are formed, and these neural crest cells and how they give rise to so many different structures. I had given you a list yesterday, remember? And we learned what are the different structures that are from mesoderm and what are the different structures that come from the endoderm. I hope you are remembering them. Those are very, very important, and they form the basics. So basically, ectoderm gives rise to what all structures? Anything that is in relation with the external environment. Neuroectoderm gives rise to nervous system. Mesoderm, you have three different mesoderms. You have paraaxial mesoderm, late intermediate mesoderm, and lateral plate mesoderm. Paraaxial mesoderm gives rise to somites. Intermediate mesoderm gives rise to gonads and excretory system. Very good. And the lateral plate mesoderm is more lateral. That gives rise to, along with endoderm, it gives rise to GI structures and everything. Okay. Lateral plate mesoderm and endoderm, as I told you, it gives rise to, along with lateral plate mesoderm, the lining of the GIT and everything. Somites, what are the different structures which are derived from somite? It forms mainly the axial skeleton. Lateral plate, appendicular skeleton. Okay. I hope you have some idea about this, so that when we start pharyngeal arches, you'll be able to correlate better. Now, what is a pharyngeal arch? Pharyngeal arch is basically like, these are the rod-like thickenings of the mesoderm that are present on the wall of the foregut. This is a very important point. Where are they present? They are the rod-like thickenings of the mesoderm. When do they appear? 4th to 5th week of development. As simple as it gets. 4th to 5th week of development, we have formation of pharyngeal arches. Right. Now, what are pharyngeal arches actually doing? They contribute to the external appearance of the embryo, especially the head and neck region. Whatever you are seeing in this angle, you see there's an external auditory meatus, and you see the mandible bone, you see the the maxilla, and you see the hyoid bone, zygomatic bone. So all of these bones and all of these things are actually coming from the pharyngeal arches. All right. Now, its development actually resembles with gills. What are these gills? Gills are the respiratory organs in fishes, right? Fishes and amphibians, and that is why they are called as branchial arch. Pharyngeal arches are also called as branchial arch. Now, how do the pharyngeal arches development take place? Right. So basically what happens is the mesoderm, it thickens to form the pharyngeal arch. You can just remember it in a very simple and easy way. right? Now, the development begins at around fourth week as the neural crest cell migrate into head and neck region. Remember, I told you the neural crest cells, which were initially ectodermal in origin, they were having epidermal derivatives. They were supposed to make epidermal derivatives, but they underwent a change, and they become mesenchymal. So whatever the structures derived from the neural crest cells, which are mesenchymal in origin, are from the pharyngeal or arches. Okay. Now, the first pair appears as surface elevations lateral to the developing pharynx. Okay. Soon after, the second and third and fourth arches also appear, but fifth arch does not develop in human beings and it is rudimentary. By the end of fourth week, you have four pairs of arches which are clearly visible externally. When by the end of fourth week, you can see here, all the four arches are clearly visible to you externally. Clearly, they are visible to you externally, and you can see here the somites. Can you see the somites here? All these condensations in the paraaxial mesoderm, and here are the pharyngeal arches. Then you see, of course, the lens placode and the nasal placode and the stomodium. So stomodium, what does it form? It forms the mouth. Correct? Yes. Now we have basically six pharyngeal arches: 1, 2, 3, 4, 5, 6. But fifth arch does not develop. It gets obliterated, and the development is, no points in guessing, always craniocaudal. Wherever the sequence comes, it is always craniocaudal. Understanding? Yes. Now let's look at the pharyngeal arches component. So basically, if let us say this is 1, 2, 3, 4, 5, and sixth arch is not there. Sorry, let me just erase it. Sorry, fifth arch is not there, right? Everything went off. Let's take the pen. So first arch, second arch, third arch, fourth arch, sixth arch, right? So basically, we have six arches in which the fifth arch is obliterated. And the components, if you look at it, it is made of ectoderm on one side, endoderm on other side, and in the middle, it has mesoderm. In the middle, it has mesoderm. But there is one exception. If you look at the first pharyngeal arch, on either side, it is made of ectoderm only. It is only the first pharyngeal arch that is made up of ectoderm only in both sides. So the one that is having both ectodermal sides is the first pharyngeal arch. And then we have second pharyngeal arch. And then we have, this is the second pharyngeal arch. This is third, this is fourth, and this is sixth. Fifth is obliterated. What is it made up of? Ectoderm, endoderm, and this is in the middle, it has mesoderm. Understanding in very simple language. So you can see in the diagram, this is the ectodermal area. This is the endodermal area. And of course, this will be the mesenchymal core. Same diagram. Whatever I've written, if you take one cut section and see, this is how it looks like. Okay? Yes. Now, what are pharyngeal clefts and pharyngeal grooves? As I told you, how does the pharyngeal arches look like? 1, 2nd, 3rd, 4th, 6th, right? This side also 1, 2, 3, 4th, 6th. As you can see some invaginations on both sides. Is it or is it not? Can you see this invagination here? Can you see this invagination here? What is this side? This is the ectodermal side. What is this side? This is the endodermal side. Now, what are these invaginations basically? These invaginations on the ectodermal side, they are called as clefts. These invaginations on the endodermal side, they are called as pouches. They are called as pouches. How do we remember what is what? Ecto, it has C. So we have clefts on ectodermal area. Endo, it has pouches. This is how you remember. Remember one, the other one you obviously comes by default. Ecto, C is coming. So clefts, endo has pouches. So the structure of a pharyngeal arch, if you look at it, how many do we have? We actually have 6 arches, but fifth is obliterated. It is made up of ectoderm, a mesodermal core, and endoderm. The ectodermal sidal invagination is called as clefts, endo is called as pouch. That's it. The whole point of this class is to now understand what are the derivatives of these ectodermal clefts, ectodermal cleft, what are the derivatives of these endodermal pouches and the pharyngeal arch as whole. That's it. If you've learned that, this topic is over. Right. Now, invagination of endoderm forms pouches and development is again craniocaudal, 4 on each side. Fifth pair is absent or rudimentary. Is it understood? Understood. So this is a complete structure of a pharyngeal apparatus. All right. Yes. Next, what are the different structures that are present in a pharyngeal arch? If you take a section, if you take a section and see what exactly are the structures present in the pharyngeal arches. We have an aortic arch, which is an artery. And we have a nerve that supplies the mucosa and the muscles which are derived from that artery. There's an artery, there is a nerve, and also we have a cartilage that forms the skeleton of the arch and the muscular component that differentiates into muscle. So basically the outer structure of the pharyngeal arch, it has all the clefts and pouches, ectoendoderm and mesodermal core. If you take one pharyngeal arch as such, if you take one pharyngeal arch and take a cut section and see, it has an artery, it has a nerve, it has a cartilage, and also it has the muscular component that gives rise to muscles. Okay, these are the structures present in the pharyngeal arches. Next, you have to understand the concept of pre-traumatic branch and post-traumatic branch. So what does it mean exactly? You can see clearly there is a nerve that is coming out of first arch, and all of us know nerve of first arch is mandibular. The nerve that comes out of an artery of a pharyngeal arch is called as a post-traumatic nerve, okay, which is normal, right? From the second, arch, we have facial nerve coming in. From the third arch, we have glossopharyngeal nerve coming in. Is it or is it not? So whatever the nerves that are coming out of these arches, they are called as post-traumatic branch of this nerve. Those are called as post-traumatic branch. But if you look at here in this area, between the second nerve and the first nerve, there is a connection. And what is this connection? What is this nerve that is arising from the second but coming out of first arch? This is chorda tympani nerve. Chorda tympani nerve. So what is that chorda tympani nerve, guys? This is a branch of the facial nerve that is supposed to be a second arch nerve, but it comes out of the first arch. Those nerves are called as pre-traumatic branches. Post-traumatic is the nerve of that particular arch. Okay, pre-traumatic is this chorda tympani nerve that is a second arch nerve, but that comes out of the first arch. So whatever the muscles that are supplied by chorda tympani also are derived from the first arch itself. And we'll see how. Okay, now let's look at the nerves of the pharyngeal arches. Right. First arch has mandibular branch of fifth nerve. Mandibular branch comes out of which foramen, guys? If you remember, cranial cavity foramina, which I had taught, mandibular comes out of male structures. M for mandibular, accessory meningeal. L for lesser petrosal nerve. E for emissary veins. What are these structures? These are all structures coming out of foramen ovale. F for ovale, male, rhyming. Okay. This mandibular branch, which we had learned in detail, is the nerve of the first arch. Facial nerve is the nerve of the second arch. Glossopharyngeal nerve of third. Superior laryngeal branch of vagus and recurrent laryngeal branch of vagus is the nerve of fourth and the sixth arch respectively. The first arch is mandibular, second is facial, third is glossopharyngeal, fourth and sixth is from the vagus. Understanding? Anything difficult here? Yes. Let's look at the first pharyngeal arch, mandibular arch, and it basically divides into a dorsal maxillary process and the ventral mandibular process. So whatever the bones that you have that you come across in this area, right, which I'm pointing out here is all derived from the first mandibular arch. Now, what are the different bones can you see here, guys? First is the mandible, then you have the maxilla, then you have the zygomaticus bone, then you have the vomer and the squamous part of the temporal bone as well. Petrous part is inside, squamous part of the temporal bone as well. So whatever the bones that you have over here is all derived from the mandibular arch. It's the first pharyngeal arch. What is the nerve? Mandibular nerve. What are the bones that are derived? Maxilla, zygomatic, squamous part of temporal. All of these bones are derived from the first pharyngeal arch. Understanding anything difficult at all here? Look at this. If this is the optic placode and this is the nasal placode, and here is the mandible and maxillary areas developing. This is how even our face looks like it, right? Optic placode is here, nasal placode is here. This is the maxillary and the mandibular area. Can you see how beautifully the structures are derived from this? Isn't it looking logical that all of these structures are derived from the first arch? Look at the position of nasal and optic placode. Is it or is it not? Right? Yes. Next, what is the cartilage that is derived? Meckel's cartilage. All MM structures come from this. Okay. Next, again, artery is again maxillary artery. All MM structures are coming from the first mandibular arch. Okay. Now the Meckel's cartilage, ventral part gets absorbed into the developing mandible, where the mesenchymal mandibular process gives rise to mandible by intramuscular ossification. Dorsal part gives rise to two bones and two ligaments. What are the muscles? Again, whatever the muscles that you have over here are muscles of first pharyngeal arches. What are those muscles? Masseter muscle, temporalis muscle that is here, medial lateral pterygoids. What are these medial lateral pterygoid, anterior belly of digastric, mylohyoid? What are all these bones, guys? So what are all these muscles? These are the muscles of mastication. Muscles of mastication are supplied by what? Fifth nerve. So obviously all these muscles are also coming from the same arch. Does it or does it not make sense? Simple. Masseter, temporalis, MT, LT, anterior belly of digastric, mylohyoid, tensor tympani, and tensor veli palatini. What is this tensor tympani, guys? Tensor tympani is the muscle that is supplied by chorda tympani nerve. Tensor veli palatini is also supplied by same chorda tympani nerve, isn't it? Yes. So the first pharyngeal arch nerve is the mandibular branch, and the chorda tympani of the facial nerve is the pre-traumatic nerve. Artery is the maxillary artery. What is this pre-traumatic nerve? I've already explained. Whatever the muscles that are supplied by these two nerves come under the muscles. Whatever the bones that are present over here come under this arch. One arch sorted. Let's move on to the second pharyngeal arch. Come a little down. Right now we are talking about second pharyngeal arch, which is basically supplied by facial nerve. Facial nerve is the nerve of the second arch. All the structures which are coming from S. Here you can see all of the structures were coming from M. Here you are seeing all structures which are coming from S. Look at this, guys. In an order, look at it. Stapes, Richter cartilage, hyoid bone here. It's all a little down now, right? Now stapes, and what is there here, which is related to the facial nerve? Styloid process, isn't it? It comes out of the styloid foramen. So what is the bony prominence that is related to facial nerve? Styloid process. Then stylohyoid ligament, smaller cornua of hyoid and superior upper half. If you look at the hyoid bone, it is derived from two arches. The lesser cornua of the hyoid and the superior half is what is derived from the second pharyngeal arches, whereas the greater cornua and the lower part is derived from the third arch. It's the only exception, but otherwise stapes is easy to remember, isn't it? Because the malleus and incus is actually derived from the first cranial arch. What is left out? Stapes. Stapes is much inside. So stapes is derived from the second cranial arch. And what is the bony prominence that is related to facial nerve? Styloid process, stylohyoid ligament, upper half of and the smaller cornua of hyoid bone. All of these are bones. Muscles of second pharyngeal arch, facial nerve supplies muscles of facial expression, occipitofrontalis, platysma, stylohyoid, posterior belly of digastric, anterior belly was coming from what? First arch, supplied by V3. Posterior belly of digastric, stapedius muscle, which is helps in dampening the sound, and auricular muscles, orbicularis oculi, orbicularis oris, and all of these muscles. Right? Nerve is the facial nerve, arteries, stapedial artery, muscles, all of the muscles that I've listed over here, and bones are hyoid, styloid process, stapes, and all of those. Sorted, anything and everything comes from S. S is second pharyngeal arch. Third pharyngeal arch, you have only one nerve coming in, that is glossopharyngeal nerve, and which is the one muscle that it supplies? Stylopharyngeus. Stylopharyngeus supplied by glossopharyngeal nerve. And what are the cartilage? I've already told you. What are the muscles in the cartilage? Greater cornua of hyoid and lower half of body of the hyoid bone. Third pharyngeal arch, three things to remember. One is bone, that is greater cornua of hyoid, and only one nerve comes, glossopharyngeal nerve. Only one muscle it supplies, stylopharyngeus. Third pharyngeal arch, three things to remember. Second pharyngeal arch, all with SSS things. First pharyngeal arch, all with MM things. Three pharyngeal arches sorted. Come to the fourth pharyngeal arch. Fourth, cartilages little lower down. If this was first and below was second, third is all the lower part of the hyoid. It is little lower down now. Fourth is even lower. Fourth and sixth are, I would say, sort of similar. I mean, there's no much difference in the way how muscles are and cartilages are derived here. But just for your information, cartilage is a thyroid cartilage. Muscles are constrictors of pharynx, cricothyroid, levator valley palatinian. Nerve is the superior laryngeal nerve, which is a branch of the vagus. Okay, cricothyroid, and all of these different muscles, constrictors of pharynx, and all the muscles of pharynx except for stylopharyngeus. Why? Stylopharyngeus was supplied by third. From the fourth arch, we have all constrictors except stylopharyngeus, which was supplied by glossopharyngeal nerve. Understanding? Yes. Then sixth pharyngeal arch, all cartilages except epiglottis. These exceptions are very, very important. Okay. And all intrinsic muscles of larynx except cricothyroid, because crico was coming from the fourth pharyngeal arch. Nerve is obviously the hero of laryngeal supply, RLN, recurrent laryngeal nerve. Artery, pulmonary arteries, and ductus arteriosus. Sorry. And the ductus arteriosus. Okay, so this is just a complete, I would say, the summary of whatever we had learned. Arch is there, nerve of arch, muscles of arch. First, mandibular, all of the muscles of mastication, and two muscles which are supplied by chorda tympani, tensor tympani, and tensor palatii. Facial, all of the muscles of facial expression, stapedius and auricular muscles. Glossopharyngeal, one of the constrictors, stylopharyngeus. Three things to remember in third arch. Fourth arch, superior laryngeal, all of the muscles of pharynx and larynx except for crico. Cricothyroid is one cartilage which is coming here, but RLN supplies it's not fifth, it is sixth. Fifth is obliterated. Sixth arch, and sixth arch, cricopharyngeus, and all muscles of this. Okay, this is just another, all of things are summarized here. Muscles of mastication and premaxilla, maxilla, skeletal contributions, sphenomandibular ligament, nerves, arteries, everything, first, second, third, fourth, and sixth arches summarized here. What is very important here is the nerves. Nerves are the most important, and skeletal contributions as well. At least some of the bones you should know. And muscles you can write by yourself if you have understood the anatomy of these nerves, how they come, what they supply. Muscle contributions is very easy to write. All these are very important, guys. These are sure short 5-marker and 3-marker questions in your exam. Just derivatives of first arch, derivatives of second arch, derivatives of third arch. It's a sure short questions in your examination. 100% you will be asked in Viva. There are embryology models, right? We study embryology models in gross anatomy, na? So when you're studying models, these somites and pharyngeal arches and all will be kept, is it not? We studied all this in first year, remember? So all of these are asked, and this table, if you learn and go, I can assure you that 10 marks you will aram se write in your exam. Next, let's look at the ectodermal cleft. Just in ectodermal cleft, just know only one. You have only second to fourth clefts are all obliterated, which makes sense because if you see, this is all ectodermal in origin. You don't see any invaginations here, right? From here to here, if you see the development, there's only one invagination present, which is external auditory canal, external acoustic meatus. Both are the same, by the way. So external auditory canal is the only invagination present if you look at the ectodermal development here. So obviously, second to fourth is obliterated. You cannot see. Do you see any openings here? No. Why? Because second to fourth is obliterated. Only one ectodermal cleft is left, and that forms the external acoustic meatus and pinna, and also the lateral layer of the lateral covering of the tympanic membrane. So if this is ectoderm, and in the middle you have mesoderm. So obviously mesoderm forms the tympanic membrane and all of those bones, isn't it? And the endoderm forms the innermost stapedias and all of those structures. Correct. So what you have to remember about ectodermal clefts is only one thing. There's only one cleft left, that is the first cleft, which forms the external acoustic meatus. Everything else is obliterated. If they are present, it causes branchial cysts or sinuses. Branchial cysts or sinuses. Okay? Yes. Then, derivatives of first pharyngeal pouch. Derivatives of first pharyngeal pouch. Pouches are from the endoderm, isn't it? If you look at the structures, this is the ectodermal side. This is the endodermal side. Ectodermal side is cleft. Only one cleft left. Endodermal side, we are studying now, which is the first pharyngeal pouch. Okay. The first pharyngeal pouch expands and it forms the tubotympanic recess. Does it not make sense, guys? You know, it is very logical if you look at it, right? If you look at this, it's extremely logical. Why? Because if the ectodermal part is forming the external auditory canal and pinna, as you go inside, the mesoderm will form all the skeletal structures, right? All the skeletal structures and everything is formed by the mesoderm. What are the skeletal structure? Malleus, incus, and stapes and everything. What else is there inside the ear? What else is there inside the ear? More deeper, the endodermal structures inside the ear. They are the inner layer of the tympanic membrane, middle ear cavity, auditory tube, mastoid antrum, tubotympanic recess. So all of these are formed from the endodermal structures, which is the pouches. From the first pharyngeal pouch, whatever that is there in the interior of the ear forms the first. Similarly, second is this area. This is all ectodermal and skin and everything is from ectoderm. Let's say the mesodermal components are all the bones and the muscles. What are the endodermal components? What is there inside? If in all of these areas, what is there inside? Palatine tonsil. Just below the ear, we have the palatine tonsil. And even come a little further below, what do we have? Thyroid and parathyroid, right? So thymus and inferior parathyroid is what forms the third pharyngeal pouch. From the fourth, we have superior thyroid gland, isn't it? So that's how we have to approach this. If you look at it from the first, you're having primitive tympanic cavity and the auditory tube. from the first pouch, pharyngeal pouches. These are the pouches and these are the clefts. As you can see, there's only one cleft and all of this is obliterated and it forms a sinus here, which also gets closed. If it doesn't get closed, branchial cyst. Then from the second, below that, you have palatine tonsil. Below that, you have parathyroid gland inferior and thymus. Below that, you have superior parathyroid gland and ultimobranchial body. So basically, what is this UBB? Ultimobranchial body. So UBB is actually the remnant of the fifth pouch. Fifth entire arch itself is obliterated, right? Whatever the remnant that is there, right? That forms the UBB. Okay. Now the neural crest cells, they migrate to UBB and there they form the parafollicular cells which secrete the calcitonin. Parafollicular C cells are actually coming from the UBB. Okay. UBB, in the UBB, you have the neural crest cells which migrate and they form the parafollicular cells. Look at it, guys. These are all the derivatives of the second pharyngeal pouch. Here in the auricle and the external acoustic meatus, and more deeper to that, you have all of these structures. And then you can see the palatine tonsils, which are coming from the second, and deeper structures over here is the middle ear cavity and all of that, which are the derivatives of the first pouch. Second pouch, you have the palatine tonsil and the lymphoid tissues and everything. And as you come little down, you have the superior thyroid gland, inferior parathyroid gland. This is basically a section. If I take a section like this and see, this is how it looks like. You know, it is as if you're looking at your own tongue and everything. That's how it looks like. Okay. Now coming to the third pharyngeal pouch. Obviously, third is parathyroid. Tonsils and tubotympanic recess is first, tonsils is second, parathyroid, that is superior part of the parathyroid. Fourth is the inferior part of the parathyroid, and ultima branchial body is the remnant of the fifth, which gives parafollicular cells. And finally, we have the sixth. Okay. Finally, we have the fourth pharyngeal pouch, as I told you, is parathyroid. And finally, we have the caudal pharyngeal complex, which is from the fourth and ultima branchial body. Understanding what did we learn until now? What are the different things that we have learned? We have a pharyngeal arches like this: first, second, third, fourth, and sixth. Okay, first, second, third, fourth, and sixth. On the, sorry, this is a bad diagram, but please bear with me. Ectodermal side, we have clefts. From clefts, what do we have? We have only external auditory meatus and external auditory canal, pinna and everything, right? From the first arch, we saw what are all the different structures from first arch. And from the pouch is more endodermal, right? Endodermal and more deeper. Whatever the deeper structures that are there, right? Whatever the deeper structures that are there, like for example, tonsils, thyroid, parathyroid, all of these things are coming from pouches. Whereas pharynx, larynx, and cartilage and everything is coming from the arches itself, right? From the nerve, artery, and the muscles which are present in the mesoderm proper. Endodermal structures, you have all of these things, pouches. And from the second, you have the palatine tonsil. Third pouch, you have the superior part of the parathyroid. The last is the ultima branchial body, which is the it is a remnant of the fifth pouch, which forms the parafollicular cells, right? There's no sixth. These are the pouches that we have. Understanding, guys? Understanding. So let's just look at the derivatives of all the branchial clefts and pharyngeal pouches. So only one cleft left, that forms the EAM, and second overgrows all, and it finally forms the branchial sinus. Persistence will cause some anomaly. Then in the pouch, first is the what is this? Pharyngotympanic tube. So many things: middle ear cavity, tubotympanic recess, all of this. Second is tonsil, palatine tonsil just below the ear here itself. No, so if you can see the eustachian tube opening, below that itself you have the tonsils. Below that itself you have the tonsil. That is how the any tonsillar abscess can easily enter into the middle ear cavity also, isn't it? All of this study you will study in ENT. right? Then below the tonsils, what we have? Thymus, in parathyroid, and all of these structures, right? Thyroid development, we'll tell you, it's a separate class in itself. Thymus and inferior parathyroid, superior parathyroid and ultimobronchial body is from the fourth pouch, which forms the C cells of thyroid. These are the derivatives of the pharyngeal pouches. Okay, pharyngeal pouches. Understanding, guys? Understanding? Any doubt, anything at all? So, what are the things that we are supposed to be knowing towards the end of this class? Number one, first, should understand the structure of a pharyngeal arch, what this arch is, and what does it contain. It has an ectodermal portion, mesodermal portion, and an endodermal portion. Okay, ectodermal portion, endodermal portion, and mesodermal portion. What should you know with regards to ectodermal portion? Let me just take a new slide itself so that I can just write it. So what are the things that you're supposed to know? Pharyngeal arch has three components. There is an ectodermal component, there's a mesodermal component, there's an endodermal component. In the ectodermal component, you just have to know only one thing, that is about the clefts. There is only one cleft left that forms the auditory canal. Okay. In the mesodermal component, there are different things. There's an artery, there is a nerve, there are different muscles which are formed, and there are different cartilages which are formed, right? So there are totally, we have 6 arches and 5 get obliterated. So you should know 5 arteries, 5 nerves, so many muscles, so many cartilages and bones which are coming from their respective arches. Then endodermal component, very easy, guys, very easy, guys. Middle ear cavity, tubotympanic recess is everything from the first pouch. Below that you have the palatine tonsil, which is from the second pouch. Below that you have the thymus and the inferior part of the parathyroid. I'll tell you why it is inferior in our coming classes, which forms the third pouch. Fourth pouch has the ultimobranchial body, which is a remnant of fifth pouch and which forms the parafollicular cells, right? Which actually secrete the calcitonin. That's it. That's it. These are all the things that you're supposed to know from pharyngeal arches class. All right. Out of this, slightly confusing aspect is this from the mesodermal. But remember, guys, first arch is mandibular nerve, so muscles of mastication, and tensor tympani, because it has chorda tympani nerve also. Second is facial. Facial is mainly what all facial? Important is facial expressions. Third, 3 things to remember. Stylopharyngeus supplied by glossopharyngeal nerve, right? That's it. That's it about the third arch. Then fourth arch. Fourth arch is mainly all constrictors of pharynx except for stylopharyngeus, which is supplied by superior laryngeal nerve. Fifth arch, all the laryngeal structures, laryngeal muscles, except for cricothyroid, because crico is coming from fourth. Crico is coming from fourth, right? So cricothyroid. So from fifth arch, you have all the cartilages of larynx, and which is supplied by recurrent laryngeal nerve. It may look difficult when you are studying it for the first time, but categorize it, right? Categorize it, then you will be easy to, it looks easy for you to answer once you have these categories. From endoderm, we have just clefts. From ectoderm, you have pouches, first, second, third, fourth pouch. From mesoderm, we have all of these, that entire flowchart that I taught you. All right, guys. I hope today's class was useful to you. I hope you have learned something, and just make a table, make a flow chart. I think you will be sorted. It's not very difficult for you to learn. I'm sure you all will excel in this, right? But it's a very important class, guys. There's no way not understand. The reason why we find it difficult is because we mix up things, we jumble everything, and we don't understand which part of the pharyngeal arch I'm talking about. Just read it this way. There's an ectoderm, cleft, endoderm, pouch, mesoderm, that big table. That's it. Pharyngeal arches is very easy class. If you know this much, you are sorted. Any doubt, you can follow us across the social media handles. We'll be more than happy to answer all your queries. All right, guys. Thank you so much for watching. Thank you so much for being here. And I wish you guys all the very best. I'll see you in the next class. Thank you.